The sound never ends with a bang. It just stretches out thin and merciless until everyone in the room understands it. Beep. The monitor in Trauma Bay 4 showed a flat green line. The last flicker of electrical activity had vanished seconds ago. Fluorescent light washed the man's bare chest in a sickly pallor, highlighting the purple bloom of bruising that crossed his ribs. Dr. Gabriel Knox stepped back from the side of the gurney. His gloves were glossy with blood, his white coat untouched. He glanced at the clock on the wall, not at the face of the boy who had been breathing 20 minutes earlier. Time of death 21:17, he said. No one argued. The respiratory therapist let go of the ventilator bag. The nurse at the foot of the bed froze with one hand still on an IV roller clamp. A second-year resident, cheeks flushed and hair plastered to his forehead with sweat, kept his palms on the patient's sternum for one last compression. Doctor, Knox said without raising his voice. The resident's hands lingered, pressing down as if sheer force could drag the line back into a rhythm. For a heartbeat, the only sound was the rustle of the disposable gown as he moved. Dr. Patel, Lankakas. Oh, Knox added, eyes on him now. We do not play hero with dead people, call it. The resident swallowed, nodded, and stepped away. The smell of blood and antiseptic pressed in as the team separated. A nurse silenced the monitor, cutting off the steady wail in mid-note. The room felt wrong without it too quiet, like a television left on mute. Knox peeled off his gloves, one smooth motion, then another. They fell into the biohazard bin with a soft slap. Clean the bay, he said. Get ready for the next one. He walked out through the open doors, and the noise of the emergency department rose to meet him. Voices, phones, the rattle of gurney wheels on tile. The sound wrapped around him and swallowed the silence behind his back. Outside Trauma Bay 4, life went on. The next morning, the hospital smelled of burnt coffee and cold air. Someone had propped the ambulance bay doors open to let the November chill leak inside, and it mixed with the hot chemical tang of disinfectant in the hallways. Dr. Elena Ward stood just inside the threshold of Trauma Bay, 2, hands in the pockets of her short white coat. A chart was clipped to the end of the bed monitor, leads coiled in a neat loop, the room empty for now. She took in the layout with quick, practiced glances. Oxygen here, suction there, airway cart against the far wall. Everything where it should be. You're the replacement. The voice came from the doorway on her left. Flat, not curious, a verdict, not a question. Elena turned. Dr. Gabriel Knox blocked most of the light from the corridor. The same white coat as last night. The same stillness. His tablet was tucked against one hand like an extra limb. His eyes scanned her once from ID badge to shoes, then lifted back to her face. Dr. Ward, Elena transfer from Portland General. I read that, he said. His gaze dropped to the tablet, flicked across the screen. She heard a monitor chirp faintly in another room, the beep of a successful IV pump. You are a second-year surgical resident, he went on. You have completed rotations in general surgery, vascular, and trauma. You have also transferred programs once already. Twice, Elena said. Portland was the second. That made him look up fully. Twice, he repeated, which tells me either you have trouble with protocol or you believe you know more than the people teaching you. He stepped into the bay. The overhead light hummed as it warmed. He was close enough now that she could see the permanent grooves at the corners of his mouth, the faint mottling of old sun on his skin. Which is it, Dr. Ward? He asked. Sure, he asked. Elena pulled her hands from her pockets. Her fingers flexed once, then stilled. I learn fast, she said. I work hard. I follow what keeps the patient alive. That was not one of the options I gave you. No, sir. They looked at each other for a beat that stretched. The noise from the main corridor seemed to recede. Somewhere, a child laughed sharp and out of place in a trauma center. Knox was the one who broke eye contact. His gaze drifted down as she reached for a box of gloves on the wall. He saw it before she remembered to hide it. Just above her watch band, circling the inside of her left wrist, a line of ink curved around the faint outline of a caduceus. At first glance, it looked like decorative dots and dashes, the kind of minimalist design interns got in college. Knox frowned. What is that? He said. Elena glanced down as the latex snapped over her knuckles. For a fraction of a second, the tattoo was exposed fully black against her skin. Then the glove covered it, and she tugged her sleeve into place. Something personal, she answered. We have a dress code, Knox said. No visible ink. This is not a bar on Colfax. I will keep it covered. She met his eyes when she said it. Her gaze was level steady. There was a calm there that did not match the shoulders of someone on her first day in a new program. Knox made a non-committal sound. It could have been a grunt. It could have been dismissal. His tablet chimed once. You are on appendectomies today, she said. His tone shifted from confrontational to purely administrative. Dr. Shaw will supervise. Your first case is in pre-op 1, routine. Try not to improvise. Yes, sir. Good. He started to turn away, then paused and looked back at her wrist, now hidden. Keep it covered, Suiche, he said, and Dr. Ward. Yes? This hospital runs on protocol, not on secrets. He left without waiting for a reply. The noise of the emergency department flowed back in to fill the bay. Monitors beeped, wheels squeaked. Somewhere a nurse called for a respiratory therapist. Elena let out a breath she had not realized she was holding. She was not here to impress him. She was here to work. Do not take it personally, a new voice said. Elena turned. A nurse in navy blue scrubs stood at the medication cart by the wall, counting syringes into a drawer. His name badge read Noah Delgado, RN. His dark hair was cropped short at the sides, a regulation cut that did not quite match the casual way he leaned against the cart. He likes everyone the same, Satunshwate said. Some show it more than others. I noticed, Elena replied. Noah watched her peel off the unused gloves and reach for a fresh pair. Watched the way her fingers lined up each cuff before snapping them into place. No wasted movement, no fumble. You prior service? He asked, light on the surface, not light underneath. Her hands hesitated for half a second, then moved again. She took a roll of tape from the counter, checked the IV pole in the corner as if confirming it was the right height. Why do you ask? She said. You scan the room before you move, Noah said. You counted the outlets when you walked in. You check your gear twice. I like to know where things are. Yeah, he said. Me too. 4 years Army medic. Some habits stick. Their eyes met. For a moment there was something shared there. Noise dust, the sharp taste of adrenaline. It faded when a voice shouted Noah's name from the hallway. If you need anything, I float between trauma 2 and 3, he said, pushing off the cart. Word of advice, though. Dr. Shaw does not like it when people go off script. I will remember, Elena said. Noah gave her a small nod and left. His footsteps merged with the controlled chaos outside. Elena was alone again in the half-lit bay. She reached up and clicked the light off. The room fell into a softer shadow. In the dark metal of the monitor screen, she caught her own reflection. A slim woman with dark hair cinched in a tight bun, green eyes that gave nothing away. Her pager buzzed at her hip. Pre-op 1, appendectomy, patient ready. She washed her hands at the sink water running cold over skin that still felt the ghost of old desert heat. The soap smelled like citrus and alcohol. She counted 20 seconds without needing the clock. Then she dried her hands, straightened her coat, and stepped into the bright corridor, walking toward her first case at Rocky Mercy Medical Center. The monitors outside the bays kept beeping a scattered choir of steady living hearts. Pre-op 1 was colder than the hallway. The vents in the ceiling rattled softly, pushing out air that smelled like plastic and cleaning alcohol. A boy lay on the stretcher under a thin blanket, barely out of his teen's hair flattened to one side, where it had been pressed into a pillow. His chart said 22. His face made that hard to believe. He watched Elena as she walked in, eyes wide but not panicked. His girlfriend sat on a plastic chair in the corner, fingers laced so tight her knuckles had gone white. Morning, Elena said. I am Dr. Ward. I will be assisting with your surgery. Surgery? The boy repeated. So it is really my appendix. Looks that way, Elena said. She took the chart from its hook, flicked her eyes over the labs, the imaging report, the timestamps. Right lower quadrant pain 12 hours, mild fever, mildly elevated white count, ultrasound consistent with appendicitis, nothing in the report about perforation. It is routine, she added, looking back at him. You will be asleep the whole time. The incision is small. Most people go home in a day or two. His girlfriend blinked fast, like she was trying to keep the room in focus. Do people die from this, Gekka? The boy asked. Not if we have anything to say about it, Elena answered. She slipped 2 fingers onto his wrist. Warm skin a little clammy, pulse a touch faster than she liked but not racing. His abdomen was covered by the blanket, but she could see the way the fabric tightened over one side when he shifted. Any allergies, Luke? She asked, reading the first name off the label at the foot of the bed. No. Any problems with anesthesia before? I have never had anything like this. Okay. She let go of his wrist. We are going to take you to the operating room in a few minutes. Dr. Shaw is the attending surgeon. She has done more of these than you have eaten bad burritos. You are in good hands. The girlfriend let out a strangled sound that might have been a laugh. Luke smiled for the first time. As Elena stepped back, the anesthesiologist for the case appeared in the doorway, rolling a cart of medications. He gave Elena a nod that felt like an acknowledgement and a warning first case with a new attending, do not make it interesting. She stripped off her gloves at the threshold, tossed them into the bin, and headed for the scrub sinks. The scrub room was a rectangle of tile and steel, 2 sinks, 2 foot pedals, 1 clock that had been stuck at 12:15 for months. Elena turned the water on with her knee, held her hands under the stream until the temperature jolted from cold to hot. She scrubbed with practiced movements, fingers, separate nails, spaces between knuckles up to the elbows. The antiseptic soap smelled sharper here, like iodine and citrus. Drops slid down her forearms and into the collar of her scrubs. The door to the operating room swung open at her back. "First case ward," a voice asked. She recognized it even before she turned. Dr. Priya Shah in blue cap and mask, pulled down to her neck, stood with her arms folded, shoulders resting lightly against the doorframe. Her eyes were dark and quick, and they moved over Elena with a focus that felt like a diagnostic scan. "Yes, doctor," Elena said. "We do not make it a disaster. The kid is healthy. The imaging is clean. Textbook case." "Yes." Priya watched the way Elena rinsed the last of the soap, how she held her hands up so nothing touched the faucet or the sink. "Knox says you like to move around," Priya said. "I like to work," Elena replied. Priya snorted. "That is what he meant," she said. "Let us see how you do when there is more than a simulator watching." They entered the operating room together. Or 3 was all hard edges and bright light. The table at the center, the towers of equipment, the metal trays laid out with rows of instruments that shone under the overheads. The air was cooler here, a steady hum coming from filters hidden behind ceiling panels. Luke was already on the table, draped from chest to mid-thigh. Only his lower abdomen was exposed, outlined in orange from the prep solution. The anesthesia machine hissed softly, the ventilator lifting and lowering his chest in a steady rhythm. His eyes were closed now. The monitor traced his heartbeats in small green peaks. Elena felt the familiar shift as she stepped up to the table, the world narrowing to the rectangle of skin in front of her, everything else falling away. The scrub nurse held out a gown, then gloves. Elena slid into them, feeling the thin barrier settle over her arms and hands, old and familiar. The nurse placed a scalpel on the field with a small clink. "Incision, Priya." "They have some incisions," Priya said. She took the scalpel, leaned in, and made a neat cut in the right lower quadrant. The blade moved with the ease of repetition. Skin parted. A tiny line of red welled around the steel, then spread as she deepened it through fat and fascia. The smell of cautery rose when she took the bovie and touched it to a pinpoint bleeder, a sharp electric tang like overcooked meat in plastic. "Retractor," she said. The nurse handed one over. Priya slid it in, spreading the edges of the wound. The pale sheen of peritoneum gleamed beneath. "Dr. Ward," Priya said. "Talk me through what we expect to see." "Enlarged appendix," Elena said. "Inflamed, maybe hyperemic. No free fluid if the imaging is right. No abscess." "Good." Priya nicked the peritoneum and eased it open. A faint puff of air escaped, carrying heat from the abdominal cavity. She reached in with a gloved hand, searching. The smell hit Elena before she saw anything. Not the usual mix of cautery sterile prep and the background hospital scent that clung to everything. Something sourer, heavy. It curled into the back of her throat and stayed there. Her eyes followed Priya's hand as it withdrew. A loop of bowel came with it, shiny and pale. The surface was not the uniform pink she expected. Patches of it were mottled, tinged a dirty gray yellow. In the depth of the wound, thin fluid pooled thick and cloudy. Her brain named it before she did. Peritoneal contamination. Her gaze flicked to the monitor. Vitals still stable. Heart rate a little higher than baseline. Blood pressure holding. None of this was yet where the numbers could see. "Appendix is definitely angry," Priya said. "Here we are." She brought the appendix up into the light, pinched in a bowel clamp. It was swollen and red at the base, but the tip was dusky, almost black. There was a ragged split along one side that oozed more of the cloudy fluid. Elena swallowed. "Dr. Shah," she said. "What?" Priya did not look up. "There is free fluid," Elena said. "The bowel looks discolored. That is more than a simple appendicitis." Priya paused just long enough for the nurse to notice. She leaned closer, scanning the field. "The scan did not show perforation," she said. "Scans lag behind, Vijoasen," Elena answered. "The rupture could have been recent. The smell suggests bacterial spread. The cavity needs irrigation and debridement." Priya finally lifted her eyes to Elena's face. "You base that on smell, Pipkiss?" she asked. "On color consistency and odor," Elena said. "The fluid is turbid. The tissue around the appendix is grayed. If we close without cleaning, he is at risk for abscess and sepsis. The operating room grew quieter. The beeps of the monitor, the soft hiss of the ventilator, the subtle clatter of instruments being shifted were suddenly very loud. The scrub nurse glanced between them, then at the anesthesiologist. No one spoke. Priya looked back down into the wound. She tapped lightly at the discolored peritoneum with the tip of a forceps, watching the way the tissue moved, how the fluid slid around it. "Suction," she said. The nurse handed over the sterile tube. Priya cleared the worst of the pooling fluid. More seeped in from the deeper spaces. "Saline," she said. "Irrigation." The nurse readied the bulb syringe. Priya paused again, then stepped half a space back from the table. "Show me what you would do," she said to Elena. It was not surrender. It was a test. Elena did not hesitate. Her gloved hands moved into the field, one holding the retractor a little wider, the other guiding the suction tip. She asked for more saline, then another retractor widening the view into the right paracolic gutter. She worked fast, but her movements were precise, almost economical. She followed the path of the contamination, chasing cloudy pockets, before they could wall off, lifting small tags of necrotic tissue and asking for scissors with a quiet, firm voice. "Smaller suction," she said. "Longer clamps." The scrub nurse responded without being told twice. Priya watched across the table, eyes narrowing, not in anger but in calculation. "This is not first-year skill kit," she said at one point. Elena did not answer. Her focus stayed on the field. Her hands knew what to do long before her mind finished narrating it. In 18 minutes the fluid ran clear. The bowel in view had lost its sickly cast. The tissue that remained was pink and viable. The appendix lay in a specimen cup on the side table. The wound was ready to be closed. Priya leaned in, inspecting every corner. "Acceptable, Chisa," she said, which felt like praise in her voice. "We will monitor him close post-op." She straightened. "Your sutures," she added. "Let me see them." Elena began to close the fascia. Her needle bites were shallow and evenly spaced, the line of stitches so regular it looked like it had been drawn with a ruler. She used a continuous pattern that crossed and locked in a way that reinforced the contaminated field. The scrub nurse murmured to herself, appreciative. The anesthesiologist cast a quick glance over the drape and raised his brows. "That is not what we teach here," Priya said quietly. "It holds well," Elena answered. "It is designed for dirty fields," Priya said. "I have seen it in a different setting." She did not elaborate. Neither did Elena. They finished the closure in silence. The drapes came down. The monitors held steady. Luke was wheeled out toward recovery with a clean dressing and no idea what had almost started in his abdomen. In the changing room, Elena peeled off her cap and mask. Her hair sprang loose in a few damp curls at her neck. She washed her hands again, watching the water run pink for a moment, where a tiny smear of blood had clung to her skin. When she stepped into the residence lounge, the air hit her like a different kind of anesthetic. Warm, heavy with the smell of overused microwave instant noodles and coffee that had been sitting too long on a burner. 3 residents sprawled on a sagging couch, eyes glued to their phones. 2 others sat at a table under a flickering light panel, one scrolling through lab results, the other chewing on a granola bar. Conversation dropped a notch when Elena walked in. It did not stop outright, but it changed direction, shifted its weight. Dr. Jamie Park sat at the table, shoulders relaxed, tie half loosened. He had the easy posture of someone who knew where all the exits were and how to get through them first. His phone lay face up in front of him, a photo displayed on the screen. He tilted it toward Elena as she crossed to the coffee machine. "Nice stitches, Ward, you guys," she said. "Shaw already sending your greatest hits to the group chat." The photo showed a close-up of the incision she had just closed. The sutures were small and neat, marching across the skin in a precise repeating pattern. Elena poured coffee. The machine wheezed and coughed out something dark that smelled like burnt plastic. "I close what is in front of me," she said. "Sure," Jamie said. "Just interesting style. That is not how they teach it at Rocky Mercy, not how they taught it when I was a first year." "I practice," Elena said. "Nobody gets that good from practice on orange peels," he replied. "Looks like something I have seen on a field surgery blog." The resident next to him, a woman with her hair in a messy knot, leaned over to look at the photo. "Could be military stuff," she said. "My cousin did a tour in Germany, sent pictures once." Jamie tapped the screen. "That pattern is built to hold under dirt and blood, and no follow-up care," he said. Somewhere you cannot just ask for a wound vac and a second chance. Elena took a sip of coffee. It was bitter and thin on her tongue. I like things that do not fall apart, she said. Jamie watched her over the rim of a paper cup. His gaze flicked to her wrist, to the line of her sleeve. So do people who patch up soldiers, he said. Just saying. The flickering light hummed overhead. The lounge felt suddenly smaller, the walls closer than they had been when she came in. Her pager buzzed at her hip, a small vibration that cut through the thick air. She glanced at the number, then set the coffee down, still almost full. Trauma call day? Jamie asked. Page from the charge nurse, Elena said. I should go. As she pushed the door open, she heard the woman at the table murmur behind her. She does not move like a second-year gay, the woman said. No, Jamie answered. She moves like someone who has been in the wrong places at the right time. The lounge door swung shut, and the noise of the emergency department washed over Elena again, bright and relentless. The sound hit her before she reached the nurses' station. Sirens bled through the glass doors at the far end of the hall. The overhead speakers crackled, then a clipped voice cut through the noise. Attention! Incoming trauma. Multiple victims' construction site collapse. All available staff report to the emergency department. The charge nurse was already in motion when Elena rounded the corner. Her scrub top had a smear of dried blood on one shoulder headset, crooked around her neck. A clipboard was tucked under one arm, though she barely seemed to look at it. Dr. Ward, she called. Good, you are here. What is coming? Elena asked. Scaffolding down on a high-rise downtown, Beckhuckers, the charge nurse said. 3, maybe 4 stories. They are saying at least 6 critical more walking wounded. Knox is setting up triage at the ambulance bay. You are in Bay 5. That is red if we overflow yellow for now. Elena nodded. Any specifics? She asked. Chest crusher, head trauma, long bone fractures. The nurse was already turning away. We will know more when they roll in. Elena moved toward Bay 5 at a quick walk that stayed just below a run. The open doorway framed a bare gurney, fresh sheets of monitor dark and waiting. A respiratory therapist plugged a ventilator into the wall. A tech adjusted the overhead light so it pointed at the center of the bed. The sirens grew louder, then cut off all at once, as if someone had thrown a switch. For a moment there was a strange hush, the tight pause before first impact. Then the automatic doors at the ambulance bay slid open, and the noise rushed in. Shouted vitals, the squeal of stretcher wheels, a paramedic's voice battered by static. Male late 30s, crush injury to chest, possible flail segment. Pressure 80/60. Female 50s, fell 2 stories, altered mental status, unequal pupils. Open femur fracture left side, airway intact, talking too much. The emergency department rearranged itself in seconds. Bays filled. Color-coded tags appeared on wrists and wheelchairs. Knox stood near the nurse's station, tablet in hand, voice calm and loud enough to cut through the chaos. Bay 1 and 2 are highest priority, sir, he called. Unstable chest and head. Bay 3 for Glasgow, less than 8. Bay 4 hold for pediatrics if we get any. Ward, you are Bay 5. You get the open femur. Keep him alive but out of my operating room for as long as you can. Understood, Elena said. A stretcher swung into view, pushed by 2 paramedics. The man on it wore a battered orange safety vest. Blood had soaked through the fabric around his left thigh, turning it the color of rust. His hard hat hung from the strap at his chin, cracked in 2 places. Name is Miguel Alvarez, the lead medic said as they rolled into Bay 5. 43. He was on the second tier when the scaffolding went. Landed half on concrete, half on his crew. Open femur fracture left leg. We splinted, but it is ugly. No obvious head trauma. Complaining of belly pain on the way in. Elena took the far side of the bed as they transferred him across. His face twisted as they moved him, teeth clenched, a low groan barely escaping. On 3, the medic said. 1, 2, 3. Miguel settled onto the ER gurney with a jolt. The nurse clipped a pulse oximeter to his finger. The monitor sprang to life with a jumpy set of numbers. Heart rate 128, blood pressure 92/60. Sir, Elena said, leaning into his line of sight. Miguel, I am Dr. Ward. You are at Rocky Mercy. You fell at the site. Do you understand? His eyes found hers dark and glassy. Leg, he ground out. Feels like fire. We will get pain medicine in you, she said. First, I need to make sure nothing else is trying to kill you. He tried to laugh, coughed instead. His breath hitched. The sound was wrong. Shallow. She placed a hand on his chest, feeling the rise and fall under his work shirt. Air movement was equal, no obvious flail segment. No bruising bloomed yet over the ribs. She slid her hand down to his abdomen, lifting the hem of his vest. The skin there was covered in dust and a fine sheen of sweat. She pressed gently in the upper quadrants. Miguel flinched, but more from anticipation than sharp pain. Any pain here? She asked. Everywhere, he said, then sucked in a breath when her hand moved lower to the left of his navel. His abdominal wall tightened under her fingers. A hard knot lay there deep, like something that did not belong, growing behind the muscle. That spot, chef, she said. He nodded, jaw locked. Feels like something's sitting on me, he said. Like the whole building sitting there. Elena looked up at the monitor again. The numbers had shifted. Heart rate 134. Blood pressure 85/58. Get me a liter of normal saline, she said to the nurse. Wide open. Type and screen. Draw labs now. The nurse moved at once, hanging a bag, spiking the port, twisting the roller clamp to full open. The fluid began to run clear and fast. Any shortness of breath? Elena asked Miguel. Just hurts, he said. Leg and stomach, everything else is loud. The fentanyl she ordered dulled his expression a little, but the lines around his mouth stayed carved deep. Portable ultrasound, she asked, already knowing the answer. It is with Dr. Shah in Bay 1, the nurse said. They took it for the chest trauma. Elena looked toward the hall. The bustle in that direction had thickened into a knot of bodies around Bay 1. She could hear Priya's voice sharp and precise over the steady beeping of multiple monitors. Get me the second unit from supply, Elena said. If it is not calibrated, I will take it anyway. The nurse hesitated. Dr. Knox said to conserve equipment for the most critical, she said. He also said this is just an open femur, Elena answered. His blood pressure disagrees, so does his abdomen. The nurse stopped arguing and hurried out. Miguel's eyes had closed. His chest still rose and fell, but each breath was a little faster. Stay with me, Miguel, Elena said. You got anyone waiting for you at home? 2 kids, he said, eyes opening a slit. One wants to be an astronaut. One wants to drive the truck that brings the concrete. Good goals, Elena said. You want to see them do that? He tried to smile. It slipped away as another wave of pain washed through him. The nurse returned with a smaller ultrasound machine, the kind that had been pushed into a storage closet when the new model arrived last year. Elena snapped on a fresh pair of gloves, slathered gel onto the probe, and pressed it gently to Miguel's upper abdomen. The machine whirred sluggish, then displayed a grainy gray field. She angled the probe under his right rib, searching for the slice of liver and kidney that formed Morrison's pouch. The image stuttered, then resolved enough for her to see. A black pocket collected where there should have been only tight planes of tissue. It swirled when she shifted the probe, a liquid shadow. Free fluid, we see. Biavka, she said quietly. She shifted to the left toward the splenic window. Another dark crescent hugged the organ, the same shape, the same motion. The amount was not enormous, but it was there, and it was growing. The nurse peered over her shoulder. That does not look good, she said. It does not, Elena agreed. He is bleeding into his belly. She wiped the probe, straightened, and raised her voice. I need the OR on the line, she said. Tell them Dr. Ward has a trauma patient with probable intra-abdominal hemorrhage and decreasing pressure. He needs an operating room in the next 30 minutes. The nurse picked up the phone at the wall and started dialing. Elena squeezed Miguel's shoulder gently. Your leg is bad, but it is fixable, she said. Right now I am more worried about inside. You are bleeding where we cannot see unless we open you up. We are going to take you to surgery for that. Leg, he murmured. Can you fix the leg? If I fix your belly, you have time for someone to fix your leg, she said. That is the deal. He nodded once, as if that made sense. The nurse covered the mouthpiece of the phone. Orr says all rooms are full, Tug, she said. They are taking 2 crushed chests and a head bleed. They can put him on the board, but it will be at least an hour. He does not have an hour, Elena said. Dr. Knox said in his briefing that we stabilize and sort, the nurse replied. He wanted us to hold anything that is not immediately dying. Elena felt her jaw tighten. His pressure is dropping, you see, she said. He has free fluid on fast. That is an active bleeder until proven otherwise. The nurse glanced toward the hall. Knox was at the far end, near Bay 2, conferring with a trauma team and a paramedic whose uniform was streaked with dirt. His posture was straight, his gestures sharp. "I can page him," the nurse said. "Do it," Elena said. Miguel's lips had taken on a faint blue tinge at the edges. She adjusted his nasal cannula, checked the IV line. The saline had almost finished. She hung a second bag and opened the line again. It felt like pouring water through a hole in a bucket. Knox arrived quicker than she expected. He stepped into Bay 5 with the same deliberate stride, wiping his hands on a towel that had a faint smear of dried blood on it. "I told you to keep this one stable, Liam," he said. His gaze hit the monitor, then Elena, then the ultrasound machine. "He is not stable," Elena said. "He is compensating." She switched the image back on and pressed the probe against Miguel's abdomen again, angling the screen toward Knox. "Morrison's pouch," she said. "Free fluid. He is hypotensive, tachycardic, and getting worse despite fluids." Knox studied the grainy black crescent. His jaw worked once. "He fell onto his leg, he said. He did not take a direct hit to the torso." "Energy transfers," Elena said. "His harness could have shifted. A bone fragment could have lacerated something. The source does not change the fact that his belly is filling." Miguel let out a low sound. His hand groped blindly along the sheet. Elena took it for a moment, let him feel something solid, then eased away to keep her hands free. Knox checked the pressure on the monitor himself. 80/50. The digits flashed amber. "Or is full," he said. "They are already pulling a team in on their day off." "Then this goes second on the list," Elena said. "If we send him upstairs now, they can turn a room as soon as they close on one of the others." "And if I bump someone with a worse injury," Knox said. "Which is worse?" Elena asked. "The patient whose chest we already opened, who is on the table with a team on him, or the one whose bleed we have not addressed at all?" The nurse held very still, as if any movement might break the thin thread of attention between them. Knox looked down at Miguel's face. The man's eyes were half open, unfocused. Sweat stood on his forehead in tiny beads. His breathing had taken on a soft, ragged edge. "You are sure?" Knox said. "Yes," Elena said. The word was simple. It carried more weight than it should have. He nodded once sharp. "Call the OR," he said. "OR?" he said to this nurse. "Tell them this is now priority, behind the head bleed. I want a room ready within 20 minutes. Get blood down here. 2 units, type 2 uncrossed." The nurse almost sagged with relief. She grabbed the phone again and started talking fast. Knox turned back to Elena. "You will go up with him, Shai," he said. "First assist." "Yes." "If this is a bad call," he said, "it is on you." "If we keep him here," she said, "that is a bad call." They held each other's gaze for a fraction longer. Then he stepped back, clearing the way for the transport team as they arrived at the door. Miguel's stretcher rolled out of the bay, headed toward the elevators and the operating rooms above. Elena peeled off her gloves, tossed them into the bin, and reached for a fresh pair at the dispenser. Her hands were steady. The monitors in the surrounding bays kept beeping, each rhythm a separate story. The ride to the operating floor was 3 floors in an old elevator that smelled faintly of metal and stale air. Miguel lay on the gurney under a thin blanket IV bags, swinging slightly with each jerk of the car. His eyes were closed, lips parted. The beeping from the portable monitor was a little faster than it had been in the bay. Elena stood at his left side, one hand on the rail, feeling every small sway. "Pressure?" she asked. 90/50, the transport nurse said. "Holding for now." The door slid open onto the surgical corridor, all polished floors and bright light. The OR charge nurse met them halfway. "This is the bleed from the collapse?" she asked. "Probable intra-abdominal hemorrhage." Elena said. "Fast positive, unstable in the ED." "Or 2 is turning over," the charge nurse said. "Knox is scrubbing in 1 for the head. You get 2. They are mopping now. Anesthesia is ready." Miguel was wheeled into a small holding area for less than a minute before the doors to OR2 swung open and swallowed them. Inside the room was reset. Fresh blue drapes folded on metal trays. A new pack of instruments neatly laid out. The air ran cool against Elena's neck as she scrubbed again, hands moving on muscle memory, while her mind stayed with the man on the table. When she stepped through the OR doors in gown and gloves, the anesthesiologist had already placed Miguel under. The ventilator breathed for him, chest rising and falling under the drapes. Knox stood at the head of the table, adjusting his cap, hands held in the air dripping. His eyes flicked once to Elena as she took her place opposite him. "You called this bleed," he said. "Yes," she said. "We find nothing, you get the joy of telling him why he has a large scar anyway. If we find nothing he needed, it ruled out," she said. "Scalpel," he said. The scrub nurse placed the instrument in his palm with a small exact motion. He made a midline incision starting above the umbilicus and traveling down. The blade parted skin and subcutaneous tissue layer by layer. The smell of cautery filled the air again as he sealed small vessels. "Retractor," he said. Elena took hold, her fingers wrapping around the cool metal, holding the wound open so he could see. He opened the peritoneum in one careful stroke. Dark blood welled up at once, thicker than it should have been, pooling into the incision. It had the color of old wine in bad light. "Well," Knox said, "there is your answer." "Sponges," Elena said. The scrub nurse began handing over laparotomy pads. Elena layered them into the wound, soaking up blood, pushing gently toward the left side, where the fast had looked worst. Under her palm, she could feel the swell of a hematoma firm and pushing back against the pads. "Left upper quadrant," she said. Knox nodded. He extended his hand. More pads. They worked together, moving with a practiced rhythm that did not require commentary. Elena kept track of the sponge count with a part of her mind while another part assessed each new glimpse of tissue. The spleen came into view, nestled high against the diaphragm. A long tear raked across its lower pole, oozing bright red. "Splenic laceration," Knox said. "Not complete." "Duyet said he can keep it if we can get it to behave." "Proximal control," Elena asked. "That is the plan," Knox said. "Clamp." He dissected toward the splenic artery. Elena held the retractor steady, altering the angle when he asked without being told. When the artery was exposed, he placed a vascular clamp, then turned back to the organ itself. "Lap pad," so he said. "We will pack around it and let the pressure help us." They packed. The bleeding slowed, then stopped under the combined force of metal and cloth. "Pressure," Knox called to anesthesia. "Coming up," the anesthesiologist answered. 95/60. Knox stepped back half a pace, eyes moving over the field, then to Elena. "You saw it at the bedside," he said, "through a machine that belongs in a museum." "It showed what it needed to show," she said. He considered that for a moment, then picked up a suture. "We will reinforce the capsule," he said, "and then you can close. I have to get back downstairs before the rest of the building collapses." He stitched quickly, reinforcing the torn splenic capsule with small, tight bites that cinched the tissue together. When he was satisfied the repair would hold, he removed the clamp. A brief ooze came from the edges. He touched it with cautery, and it sealed. "Maintain packs for pressure," he said. "We will pull them in 48 hours if he behaves." He stepped back, peeled his gloves off in a neat roll, and left the closing to Elena. She worked in silence, layer over layer. Peritoneum, muscle, fascia, skin. Her sutures drew the tissue together in a fine, even line. The scrub nurse, older than both of them, watched her hands. "I have been in this room 25 years, the nurse said softly. "Those hands do not belong to a second year." "I practice," Elena answered. The nurse smiled a crease at the corners of her eyes. "Not on orange peels," she said. When they wheeled Miguel out toward the recovery, his vitals were steady. His skin had regained some color. He would have a scar he had not expected when he got up that morning, but he would still be able to tell his children that concrete trucks and astronauts were both options. Back in the elevator, Elena peeled off her cap and let her scalp feel the rough air for a second. The doors opened onto the ER level again, and the chorus of sounds poured in to meet her. It was both familiar and slightly altered now. Somewhere in that mix of beeps and voices, she could hear the difference between the patients she had left and the ones who had come in while she was gone. When she stepped into the residence lounge, it was more crowded than before. The couch was full, bodies leaned against every available surface. Empty coffee cups and snack wrappers had multiplied on the table. Jamie sat in the same chair, but this time the glow of his phone showed a different image. Elena saw the corner of a CT scan ahead with a bright bloom of blood along one side. "They pulled you for the spleen?" he asked as she went to the sink to refill her cup. "Yes," she said. "Heard you were right again," he said. "Soft blood pressure, negative chest, positive belly." "The scan was not negative," another resident said. "They just did not have time to read it properly." Jamie shrugged. "Still," he said, 2 for 2, that is a streak." Elena let the tap run until the water turned cold. She poured it into a cup, bypassing the coffee. "We got there in time," she said. "How long have you been doing bedside fast?" Jamie asked. "A while. Long enough to trust a blurry black crescent over Knox's instincts," he said. Elena turned, leaning back against the counter cup in both hands. "It is not about trust, Yishe," she said. "It is data." Jamie held up his phone. He had enlarged the photo of her apiclosure, the sutures bright against stretched skin. Data says you sew like someone who used to work in a tent where dust got into every wound, he said. Wei said. And you call bleeds like someone who has seen a lot of people leak out on floors that were not this clean. The room fell quiet again the way it had earlier, in that small way that meant ears were tilting in their direction. Elena took a sip of water. Maybe I have just seen a lot, she said. Portland is not that exciting, Jamie said. Trust me, I did med school there. Her pager vibrated at her hip, a sharp reminder against her waistband. A different tone this time, longer, more insistent. She looked down. Code Blue Trauma 3. The cup was on the counter before the thought finished forming. She was halfway to the door when she heard the overhead speakers crackle. Code Blue Trauma Bay 3, Code Blue Trauma Bay 3. The words chased her down the corridor. Trauma Bay 3 was a knot of bodies around a single bed. The overhead light was at full strength, turning skin and gauze and metal into stark contrasts. The sound of compressions filled the room, dull thuds against bone. Noah was at the foot of the bed, arms straight, hands laced over the center of a man's chest. Sweat ran down his temples. His face had the tight, focused expression of someone operating at the edge of endurance. Priya stood at the head, one hand on a bag valve mask, squeezing air into a mouth framed by a plastic airway. Her eyes were on the monitor mounted near the ceiling. The line there was flat. 16 minutes, the respiratory therapist said quietly. Another amp of epi, Priya said, charged to 200. A nurse pressed a syringe into her free hand. She pushed it into the central line, then stepped back as the defibrillator wound itself up. Clear, she said. Noah lifted his hands. The others moved back an inch enough to break contact without losing posture. The shock snapped through the air, a visible jerk in the patient's muscles. The monitor jumped, then settled back into a straight, unbroken line. Resume compressions, Priya said. Noah leaned in again, palms finding the same spot on the sternum, pushing down. Sweat dripped off his nose onto the patient's gown. Elena edged closer, sliding between a tech and a nurse until she could see the man on the table. He was in his late 20s, maybe. Hard hat gone. A smear of dried blood cut through the stubble on his jaw. His abdomen was wrapped in thick bandages, the gauze stained dark in a rough circle low on the right side. The outer layers were dry. The inner ones close to the skin were soaked. What happened? Elena asked softly. Mohaikas softly. Rebar through the lower abdomen, the nurse nearest her said. Fire pulled it on scene so they could get him out. He lost a lot of blood before they got pressure on. How long has he been down? Elena asked. 18 from on scene, the nurse said. 16 since he lost a pulse. Nothing on the monitor, Elena asked. Occasional flutter, the respiratory therapist said. No organized rhythm. Oofa, no output. Priya glanced at the clock. 20 minutes unofficial, she said. 16 official, we are past the point of meaningful survival. She looked at Knox, who had appeared at the edge of the field, still in his blood-flecked coat from the head case upstairs. We should call it, she said. Noah kept compressing. His breaths came in ragged pulls. Doctor, he said without looking up. He's 28, name is Daniel Cole. He has a wallet in his pocket with a picture of 2 kids. Someone should at least try. We are trying, Priya said. At this point, we are just moving drugs around. She turned toward the monitor again. Time of death, she began. Wait, Elena said. The word was not loud, it cut through anyway. Every head in the room turned toward her. The compressions did not stop. Noah's shoulders rose and fell. Priya's expression cooled a few degrees. Dr. Ward, she said, we have been at this for 16 minutes. He has no organized rhythm, no palpable pulse, and likely massive internal hemorrhage. This is not a teaching exercise. Elena stepped closer to the side of the gurney, eyes traveling from the bandages to the line of the man's jaw to the flat, still plane of his chest. Where did the rebar enter? She asked. Low right quadrant, the nurse said. Exit wound and back. They think it tracked diagonally. How much blood at the scene? Elena asked. Enough to paint the concrete, the nurse said. He coded right as they loaded him. Elena hooked a finger under the edge of the bandage, lifting it just enough to see the skin beneath. Bruising had spread out from the wound in a dark halo. The abdomen was swollen more on the left side than the right. She pressed her knuckles lightly into the left lower quadrant. The flesh was tense, a drum under her touch. He is bleeding retroperitoneal, she said, tracking along the iliac vessels. If the common iliac is torn, his blood volume is pooling where compressions cannot help him. Priya exhaled. Even if that is true, she said, we cannot get control of that in time. We would need an open abdomen and proximal vascular control. He would be dead on the table. There is another option, Elena said. Priya frowned. There is no magic option for a patient who has been pulseless for this long, she said. Elena looked at Knox. Reboe, she said. Femoral access. Balloon in the aorta above the bleed. We stop the distal loss and give his heart something to pump. The word hung in the room. The respiratory therapist blinked. That is a research level, he said. We do not do that here. It is not research where I learned it, Elena said. It is standard when you do not have time to open from stem to stern and hope you guess right. Noah's eyes flicked to her face, then back to his hands on the chest. Priya shook her head. This is a civilian hospital, she said. We do not do blind aortic occlusion on a man with no cardiac activity on a hope. It is not blind, Elena said. We have ultrasound. We can place it in zone 1 and buy him time. Right now, everything we push into him is leaking out into his pelvis. Knox stepped closer, his presence shifting the air around the bed. You know the risks of reboe, he said. Aortic dissection, limb ischemia, balloon migration into the arch. If it does not work, he stays dead, Elena said. If it does, he gets a pump and a brain with perfusion. Do you know how to do it, Dr. Ward? Knox asked. Her hands tightened at her sides. For a moment, she could feel different gloves on her skin, powdered, not latex, sand in the creases. Yes, she said. From where? Priya asked. Before Elena could answer, the doors to Trauma 3 slid open. A paramedic stepped in, still in his field jacket, hair matted with sweat. His radio crackled faintly at his shoulder. He stopped dead when he saw Elena. You have got to be kidding me, he said. Major Ward. The room went even quieter. Noah's hands kept moving, pressing down, but his eyes flicked up wide. Priya turned slowly. Major, she repeated. The paramedic moved closer like he needed to verify she was not a trick of adrenaline. Camp Resolute, he said. Kandahar, Black Hawk Unit. You ran the surgical tent. I was attached to 3rd Battalion then. He gestured vaguely at the man on the table. You put a balloon in a guy like this at 6,000 feet, while the pilot was yelling about fuel. He walked again. Elena felt the room tilt just for a second. The overhead light blurred, then sharpened. Corseman Rudd, she said. Her voice sounded different to her ears, like it belonged to someone else. You made it stateside. Name is Jay now, he said. Paramedic Denver Fire. I did not expect to see you outside a tent. Priya looked from one to the other. Is any of that in your file? She asked Elena. No, Elena said. Knox's gaze was steady. 7 years in uniform, he said quietly. That is a long omission. Elena kept her eyes on him. It defined everything for too long, she said. I wanted to see who I was without it. Noah's arms trembled, his voice cut in strained. I cannot keep good compressions if we are going to let him die anyway, he said. The monitor still showed a flat line. The clock above the door ticked relentless. Knox looked at it, then at the patient. How long since loss of pulse? He asked. 17 minutes, the respiratory therapist said. 18 now. Brain cells died in those numbers. Kidneys, gut muscle, all counting down. Knox faced Elena again. If you take this on, he said, and he does not come back, it is a line in your record that will follow you. If I stand here and watch him bleed into emptiness, that is a line I still have to live with, Elena said. Her voice had no heat in it, just a flat certainty that seemed to carry more weight than volume. Knox's jaw worked once. Fine, he said. You do it. Under my supervision. If it goes wrong, it is mine as well. He snapped his head toward the nurse. Get the femoral line kit, he said. Get me the older ultrasound unit and the longest balloon tip catheter we have. I want blood ready. 2 units O negative in the room now. The room changed around them. People moved with new purpose. The energy shifted from resignation to a tense, narrow focus. Noah did not stop. His palms rose and fell. Elena stepped to the patient's right side, glancing once at the monitor, then at the groin. Somebody mark time, she said. We note the moment of occlusion. Jay moved to the foot of the bed, eyes sharp at the exhaustion from the scene replaced with something like belief. I have got clock, he said. The nurse placed the sterile kit on a small table. Elena held out her hands. The scrub tech dropped a gown and gloves into them. She suited up without looking away from the target. Her fingers moved from gown ties to glove cuffs, each motion precise. She pressed gel onto the ultrasound probe, then placed it against the skin in the right groin. The image flickered to life in shades of gray. There, she said. The femoral artery pulsed on the screen a round circle with a subtle rhythmic collapse. Weak but present. She drew a line mentally from skin to vessel. Needle, she said. The metal touched her palm, cool and familiar. She took a breath, ignored the sweat at the back of her neck, and drove the tip through the skin at a shallow angle, eyes on the screen. The bright white line of the needle advanced toward the artery. There was a brief resistance as it indented the wall, then a give. A flash of dark, oxygenated blood filled the hub. I am in, she said. Shine said. The next steps were only muscle memory and time. She threaded the guide wire through the needle, watching the bright line advance on the screen. It snaked into the artery, then up following the curve of the vessel. Wire is in, she said. Keep compressions, Knox said. His voice had sunk into the same register he used in the OR, focused, stripped of everything that did not matter. Elena slid the needle off, leaving the wire in place, a thin bridge from skin to artery. She picked up the dilator, fed it along the wire, and pressed it through the tissues. There was resistance, then the sudden give as it expanded the track. Dilator out, she said. The scrub tech placed the balloon catheter in her hand, the longest one they had. She fed it over the wire fingers, moving in small, sure pushes. The machine at her elbow showed the tip traveling up the vessel in pale echoes. Zone 1, she said half to herself, above the celiac. The catheter moved past the iliac bifurcation into the abdominal aorta. She stopped near the shadow of the diaphragm. Pull the wire, Knox said. She did. The metal slid free, leaving the catheter in place. Syringe, she said. The saline filled the barrel cold against her fingers. Inflating, she said, and start at 3. She pushed the plunger slowly. 1 milliliter, 2, 3, 4. On the pressure trace, she could see the small rise that meant the balloon was pressing against the aortic wall. 4, she said, occlusion. Time, Jay said, 22:28. Stop compressions, Knox said. Noah lifted his hands away from the chest. His arms shook. He let them hang at his sides for a second, breathing hard. The room held its breath with him. The monitor drew a flat line for 1 long count. Then a small blip appeared, then another. V-fib, the respiratory therapist said. Low amplitude. Charge to 120, Priya said automatically. Wait, Elena said. Let it fill. The trace stuttered, then the peaks grew taller, more organized. A slow, wide, complex rhythm marched across the screen. Sinus bradycardia, the therapist said. 40 beats per minute and rising. Noah let out a sound that was half laugh, half sob. He has a pulse, Elena said. She pressed her fingers to the carotid. There was a thump there now, weak but real. Pressure, Knox asked. Bast? The cuff cycled. The machine thought then displayed a number. 85/50, the nurse said, coming up from nothing. Get vascular on the line, Kutsu says, Knox said. Tell them we are bringing them a live one who should not be. He turned to Elena. You are coming with me, he said. You put that balloon in. You are going to help me fix what it is holding back. They took the whole bed upstairs. The elevator ride was shorter this time, or maybe it felt that way because everyone moved faster. In OR1, the team was already waiting. The scrub nurse had trays open. The anesthesia team had swapped out. Dr. Patel stood at the head of the table, eyes on the monitor as the ventilator pushed air into Daniel's lungs. His skin looked less gray under the surgical lights. His lips had a hint of color. Balloon is still up? She asked. Yes, Elena said. The catheter line trailed from his groin to a 3-way stopcock, the syringe still attached. Zone 1 occlusion 4 milliliters. Pressure is holding at 90/55, Dr. Patel said. Heart rate is 110. That balloon is now the only reason he has a blood pressure weight, Knox said. Let us give him a better one. Elena scrubbed again. Her hands moved faster, but the pattern stayed the same. When she stepped back into the OR, Knox was already gowned. Midline, see ya? He said, from xiphoid to pubis. She took the scalpel this time. Scalpel, she said. The nurse placed it in her waiting hand. The incision opened the length of his abdomen. Blood welled as they cut through layers. She could feel the heat pouring out of the cavity, a wave against the cooler air of the room. Retractors, Knox said. They opened the wound. Dark blood filled it thick and pooling. Suction, Elena said. Sponges. They worked together, clearing the field. The retroperitoneum bulged on the left, a tense, discolored mass. There, Elena said. She dissected carefully, her fingers finding the planes she had learned in another country under a different ceiling. She opened the retroperitoneum. Blood poured out less force now that the aorta was occluded, but enough to paint the field. The iliac bifurcation came into view, a pale fork in the red. The right common iliac artery had a ragged tear along its side, a split that would have sprayed every drop he had if not for the balloon above. We have the culprit, Knox said. Elena reached for 2 vascular clamp. When I deflate, blood will come through here, she said. I need proximal and distal control. I will clamp high on the common and low on the external. Dr. Patel saw, Knox said. You have 2 units ready. Already primed, she answered. Elena wrapped her fingers around the catheter line. Deflating, she said. Have the clamp ready to go. She pulled back on the syringe. The plunger moved. The pressure on the line eased. Above the field, Daniel's pressure dipped on the monitor. The instant the balloon lost its seal, blood surged through the aorta down into the common iliac and out through the tear. A bright red arc splashed against the pads. Elena slid the proximal clamp on in one motion, closing it around the artery above the tear. The spray cut off. She placed the distal clamp just as quickly. Reocclusion below, she said. Flow stopped across the injury. Pressure is dropping, then stabilizing, Dr. Patel said. 80/50 holding. Open a unit, Knox said. Give him volume. Elena leaned closer to the field. The tear was about 2 centimeters, edges irregular. 6-0 Proline, she said, double-armed. The needle drivers felt natural in her grip. She set the first stitch at one end of the laceration, tiny bites through the full thickness of the arterial wall. She crossed the suture to the other side, tide moved along. The room faded to the sound of the monitor, the ventilator, the faint clink of instruments passed and retrieved. Her world narrowed to blue gloves, red blood, and the pale curve of the artery. 12 stitches closed the tear. Each one landed exactly where it needed to go. Release distal, she said. The resident at her side opened the lower clamp. Blood filled the artery below the repair. No leaks. Release proximal, she said. The upper clamp came off. For a moment, nothing happened. Then the artery pulsed under the suture line. The repair held. Check pressure, Knox said. 100/60, Dr. Patel answered. Heart rate 95, better waveform. Elena stepped back a fraction, her shoulders loosened. Pack the retroperitoneum lightly, Knox said. Then let us look for anything else that wants attention. They surveyed the abdomen. No other obvious injuries. The liver was intact. The bowel looked perfused. The bleeding had slowed to the slow ooze of small vessels. Close, Knox said. Carefully, he has used up his luck for the week. They closed him together. At the end, the midline incision held with a line of staples that gleamed under the light. When they wheeled Daniel toward the ICU, the monitor showed a normal sinus rhythm. Outside the glass of the ICU room, the world looked softer. The lights were dimmer, the walls quieter. Machines stood guard at each bedside, tracing patterns of survival in green lines. Daniel lay beneath a warm blanket ventilator tube secured at his mouth. Numbers glowed over his head. Heart rate 88. Blood pressure 110/70. On the other side of the bed, a woman sat in a vinyl chair. She wore jeans streaked with dust and a jacket that did not match the weather, like she had grabbed the first thing off a hook. Her hands were wrapped around a paper cup that had long gone cold. Her gaze stayed on Daniel's face. Elena watched from the hall for a moment before stepping in. The smell in the ICU was different from the ER and the OR. Less blood, more plastic cleaner with an undercurrent of something like warmed metal. The woman looked up when Elena came close. Mrs. Cole. Elena said. Mia, she answered. Her voice was rough. They said you are the doctor. The one who... She gestured helplessly toward the bed, toward the machines, toward her husband, who should have been in a different place at this time of night. I am Dr. Ward, Elena said. We took care of him in the emergency department and in surgery. They told me he died, Mia said. The words came out flat. They said he died, and then something happened, and now he is not dead. Her eyes searched Elena's face as if the explanation might be written there. He lost his pulse, Elena said. He had a severe injury to an artery in his pelvis. Most of his blood volume was going into spaces where it could not help him. We used a procedure to stop that long enough to repair the damage. Procedure, Mia repeated, like something you planned for. Not exactly, Elena said, but something we trained for. Is he going to wake up? Mia asked. The words landed with more force than all the others. The surgery went well, Elena said. Right now his brain has blood flow and oxygen. His heart is strong. He is on a ventilator until we are sure he can breathe safely on his own. We will watch him very closely. Mia looked back at Daniel. For a moment, the hardness in her shoulders eased. Our girls are 4, she said quietly. Twins. We left them with my sister when he got the job on that site. He said it paid better. He said it would be a few months of dust, and then things would calm down. Elena followed her gaze to the little snapshots taped to the wall. 2 small faces, identical except for the crookedness of one smile, stared back at them in frozen delight at a playground. He has a better chance now of seeing them grow up, Elena said. Mia's eyes filled, but the tears did not fall. How do you do this? Mia asked. See this? Do this? Then go home and eat dinner like nothing happened. Elena thought of her old bunk of a mess tent with plastic trays and bad coffee of nights when she had gone back to a cot and stared at a fabric ceiling for hours. I do not eat dinner, she said. She said. It was as close as she could come to an answer that did not lie. Out in the hall, footsteps approached. Knox came to stand beside her coat-off, now scrub-top, wrinkled lines deeper at the corners of his eyes. How is he asked. Stable, Elena said. No signs of new bleeding. Vitals are good. Knox nodded. His gaze shifted to Mia, then back. You should get off your feet, he said. You have been running since morning. So have you, she said. I am not the one who wrestled an artery back to life tonight, he said. His voice stayed low. That was work I have only seen in videos from combat hospitals. Elena watched the monitors, the green lines moving in quiet loops. It is just technique, she said. It is more than that, he said. 7 years as an army surgeon, at least 3 of them in active zones, and you did not think that was relevant to mention on your application. If I had led with that, she said, it would have been the only thing anyone saw. Instead, Baon, he said, you let us think you were reckless or unsure because you moved too fast for a second year. She did not argue. He stared at the reflection of his own face in the glass for a moment. I looked at your file while you were upstairs, he said. The real one, not the redacted version. Dr. Hart found it. The name twisted something in her chest. Chief of Medicine has opinions about surprises, he added. She wants to speak with you. When? Elena asked. Now, he said. Dr. Evelyn Hart waited in a small conference room off the ICU corridor. The fluorescent light was kinder here. The table was scarred from years of elbows and coffee cups. A folder sat open in front of her. The papers inside were stamped with lines of black where censors had passed. Enough words remained to tell a story. Dr. Ward, she said as Elena entered. Or should I be saying Major? Doctor is fine, Elena said. Hart studied her for a long second. There was no hostility in it, only assessment. I made a few calls, Hart said. One to the credentialing office, one to a friend in San Antonio. Apparently you have done this kind of thing before. I have done surgery before, Elena said. This kind of surgery, Hart said. On people who were not supposed to live. She touched the folder with one fingertip. 847 combat procedures, Hart said. 92% survival rate in conditions that would have shut down this hospital in an hour. Her tone did not carry awe. It was closer to disbelief wrapped in facts. You left with a medical discharge, Hart continued. PTSD documented. Recommendations for continued service if you had wanted it. Elena kept her eyes on a knot in the tabletop. I did not want it, she said. I can see why, Hart said. I read the report on the helicopter incident. I'm sorry you went through that. The air felt tighter for a moment. Elena nodded once. You have been here 8 weeks, Hart said. In that time you have corrected one appendectomy called one splenic bleed and brought one dead man back to life who had already been given a time of death. She folded the folder closed. I do not like surprises, Vijay said, but I like wasted talent less. Elena waited. Knox has been trying to build a trauma protocol program for 2 years, Hart said. We have funding. We have residents eager to learn. What we do not have is someone who has seen the worst-case scenarios enough times to teach from experience. Her gaze held Elena's. I want you to run it, Hart said. Not as a second-year resident. As a trauma surgeon with full attending privileges. You would design the curriculum. You would train our staff. You would make sure what happened in Bay 3 tonight is something we can reproduce on purpose, not by luck and hidden history. The words landed with a weight that made the room feel smaller. I'm not finished, Hart said. There are conditions. All right, Elena said. First, Hart said, no more hiding your service. It goes into your official record here. People need to know why you know what you know. Second, you develop training for treating veterans specifically. We see them. We do not always understand them. You do. She paused. Third, she said, you go back to therapy, not the bare minimum to get a discharge. Someone who understands military trauma, because you cannot keep operating at this level without somewhere for the weight to go. Elena felt something in her chest shift, not pain, more like an old splint giving way. I will think about it, she said. Think quickly, Hart said. Word is already spreading about what you did. By morning, half the hospital will know a dead man in Bay 3 has a heartbeat because you refused to stop. She rose from her chair. Go home for a few hours, she said, or at least sit down somewhere that is not next to a monitor. When Elena stepped back into the ICU hall, Mia was still in the chair beside Daniel's bed. Her head had dropped forward, chin on her chest, fingers still wrapped around the empty cup. The monitor above Daniel ticked along steady. Elena looked at him through the glass. The bandage over his abdomen rose and fell with each controlled breath. There was a small smudge on the window where a child had once pressed sticky fingers. She pulled her phone from her pocket in the quiet of the corridor. Hart's number glowed on the recent call list. Elena typed slowly each word a choice. I will take the position, she wrote, on all 3 conditions. She hit send. In the room beyond the glass, the green line kept moving. 2 weeks later, the conference room off the main lobby did not look like itself. The long table had been pushed against one wall. Rows of chairs filled the space, instead everyone taken, residents in short white coats, attendings with stethoscopes looped around their necks, nurses in navy and seal, 2 paramedics still in their station jackets, radios clipped at their shoulders. At the front, a projector hummed. A slide glowed on the screen. Rocky Mercy Trauma Training, Instructor Dr. Elena Ward. Elena stood beside the screen, fingers resting lightly on the edge of the podium. Her hair was pulled back tighter than usual. The badge on her coat now read simply trauma surgery without a residency year under it. Knox leaned in the doorway, arms folded, watching. "My name is Elena Ward," she said. Her voice carried clear but not loud. 7 years ago, I was an Army combat surgeon. 3 years ago, I tried to leave that behind. 8 weeks ago, I walked into this hospital pretending I had never been there. She clicked the remote. A photo filled the screen. Daniel Cole in a hospital gown, sitting up in bed awake. A ventilator absent. 2 identical girls perched on either side of him, each holding one of his hands. They were grinning at something out of frame. "This is Daniel," she said. "Scaffolding collapse, rebar to the abdomen, no pulse for 17 minutes. He is here because a lot of people refused to stop when the numbers suggested they could." No one spoke, even the air vents seemed quieter. "This program," Elena said, "is about sharpening your tools for the moments when the book does not cover what is in front of you. You will learn battlefield procedures adapted to civilian settings. You will learn to read a room, a monitor, a patient faster and more accurately. You will learn when to keep going." She changed the slide again. An image of a stylized aorta appeared, colored zones marked along its length. "Today we start with Reboe principles," she said. The weeks that followed reshaped the 3rd floor of Rocky Mercy. A disused wing became a simulation lab. Mannequins lay on stretchers, plastic skin cut, and taped chests that could be opened with practiced hands. Ultrasound machines hummed. Overhead speakers played recordings of sirens and shouted vitals. Elena stood behind glass, more often watching teams run scenarios she had written. 3 injuries at once, limited resources timers, counting down on the wall. She critiqued without raising her voice, adjusted hand positions, corrected decisions that cost imaginary lives. Noah was there too, at her side. He drilled airway skills with young nurses, showed paramedics the way to move stretchers through crowded halls without losing lines. "This feels familiar," he said one afternoon, watching a group triage mannequins and colored tags. "Some parts are," Elena said. "Except the coffee is worse here," he said. She smiled without looking away from the trainees. 3 months after Daniel left the ICU, another trauma came in that settled at the same bay. Gunshot wound to the chest, 25, discharged Marine, Ryan Mitchell, according to the dog tags that clinked against his collarbone as the paramedics lifted him to the bed. He was awake at first, eyes sharp with a kind of steady alertness Elena recognized. The tattoo on his shoulder was a globe and anchor. "Afghanistan twice," he said between breaths. "Thought I was done with incoming fire?" "You did not pick this one," Elena said. "We will take it from here." The bullet had tracked near his left subclavian artery. The chest tube she placed let out a sigh of trapped air and blood. In the OR, she found the nicked vessel and repaired it with the same care she had given the iliac. Ryan woke in recovery with a chest that rose evenly and a line of stitches he joked about. "Guess I get a discount on airport metal detectors now," he said. Word spread outside the hospital, too. One morning in late winter, Elena stood in a larger conference room in Washington. The seal on the wall was different. The uniforms in the seats were pressed and dark. The slide behind her read, "Bridging Battlefield Medicine and Civilian Trauma, presenter Dr. Elena Ward." She laid out the structure of a transition program, how medics could move into emergency departments without starting from nothing, how their field experience could count for more than a line on a resume. She spoke of protocols tested under fire that could serve in hurricanes and pileups and collapsed bridges. When she finished, the room was quiet for a breath, then the applause started. It rose slowly, then settled into a steady sound like rain on a roof. Outside on the steps, Noah waited with his jacket zipped to his chin. "You looked like yourself in there," he said when she joined him. "This is myself," she said. "There was a while you forgot that," he said. She did not argue. Her phone buzzed. A photo filled the screen. Daniel again, this time on a patchy soccer field whistle around his neck, hands on his hips. The twins were in oversized jerseys, laughing. The caption read, "Coach Cole reporting for duty, thank you." Elena typed back, "Live well, that is enough." Back in Denver, a new class of residents gathered in the simulation lab. They clustered around a bed where a mannequin lay hooked to a monitor that beeped at a steady pace. Elena stood at the foot of the bed, running through the outline of the next drill. One of the interns, a woman with bright eyes and a pen stuck behind her ear, raised a hand. "Dr. Ward," she said, "your tattoo. I keep seeing it peek out. What does it say?" Elena glanced at her left wrist. The cuff of her coat had ridden up a little. The black ink curved around her skin, dots and dashes looping the small caduceus. She could have tugged the sleeve back down. She did not. "It is Morse code," she said. She turned her wrist so they could see it clearly. "Old habit." The intern squinted, lips moving as she counted. "I think that spells REFUSE, she said slowly. It does, Elena said. Refuse what? Someone asked. Elena looked at the monitor. The line marched across each soft beep, filling the room, unremarkable and completely necessary. Refuse to stop while there is still a chance, she said. For a moment, no one spoke. The monitor kept time for all of them. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.